fecal transplants are helping cancer patients. I know it's really a bizarre story to talk about. We're actually using someone else's stool and putting it into your own body if you're a cancer patient. So to talk about this more, I'm here with Dr. Veeral Oza from Bon Secours. Thank you so much for joining me today.
Thank you for having me today.
It is an unusual topic and something I think some people might be a little uncomfortable with. But tell me about this. Like, what is it, and how does it work?
Yeah, so stool transplant is not something new. It's been around for several years, almost a decade plus. And it's typically done for really bad colon infections. So for example, if somebody has really bad, uncontrolled, what we call C. diff infection of the colon, then stool transplant is actually an option that is used frequently in the hospitals to help control these infections and even lead to cures. So the way it came about was people realized that when you do stool transplants, it was affecting the microbiome and starting to affect the body's own immune system in a positive way, which then resulted in the body being able to combat colon infections. So this particular study, or this report that just recently came out, studied cancer patients who were not responding well to a specific class of drugs called immunotherapy. Now, immunotherapy drugs basically alter the body's own immune system and try to help the body attack certain cancers. In this particular study, what they did was they took a patient who was not responding to these immunotherapy drugs, and they did a stool transplant from a patient who responded very well to these immunotherapy drugs and gave it to the patient who did not. And suddenly the patient started responding to the drug. So it basically confirmed that it does affect the microbiome in a positive way, where it somehow alters the immune system to lead to a positive response.
Now, how do you extract the stool so it doesn't create an infection? Because I know a lot of us, that's why we wash our hands when you go to the bathroom, so that you get rid of all the germs.
Right.
And so it's kind of mind-boggling, like how do you prevent an infection, and then how does that actually be beneficial?
That is a very good point. So what they do is they take the stool, and then again, this is all study and trial based. This is not something that's done in cancer patients on a regular basis by any means. This is really strictly in its infancy for cancer patients. But there are stool banks out there which actually hospitals oftentimes team up with, and there's actually pill formulations for things like C. diff infections that I mentioned that people can, doctors can prescribe and people can use. There's also stool enemas out there that again, hospitals can give in the hospital setting for some bad infections. For these cancer patients, however, this is all being studied in labs. So they actually extract out and treat the stool sample and make sure that there's nothing bad growing in it before they actually do the transplant. Because the last thing you want is you want to give an immunocompromised patient who's already on chemotherapy drugs a stool sample and then give them a bad infection. So that is certainly a risk of the procedure, very much like any other transplant. Getting an infection is a risk of the procedure. But if somebody has no options, then this study just showed that this is now my potential option. So it creates a good window for treatment.
And I know this research is being done at Anderson Cancer Center in Houston. Do you know of any other locations where this research is happening?
At the top of my head, I think MD Anderson and Hopkins are two places where this is being studied. But again, stool transplant and microbiome, that topic in itself is being studied in multiple different places. Specifically for cancer, I think MD Anderson is a pioneer in this.
The main hub for it. I know they have a lot of clinical trials going on that people, if they're really interested, could look into. So how effective is this? I mean, how much is it helping cancer patients?
So again, this is one of the first ones that's coming out where it's actually showing that there's some benefit. But again, since 2022, there have been a few case reports and case series being published on different types of cancer, positive response to cancer therapy after doing stool transplants. But again, it's very much in its infancy. This is not the standard of care right now. So if patients have cancer, if the viewers, anybody who's watching, then I would encourage them to talk to their oncologist about this before actually just assuming that this is a standard of care. It is not.
And what types of cancer is this being treated for at the moment?
So this was for small bowel and pancreatic. In the research of small bowel cancers and pancreatic cancers is what they were studying it in.
Okay, good to know. All right, well, thank you so much for joining us today and breaking all of that down. But stool transplants, something you don't hear about every day.
No, it's a smelly topic.
Yes, it is. All right, thank you.
Thank you for having me.